Meantime, Health Minister the Honourable Renwood Wells says he's in talks with the Bahamas Nurses Union following several days of sick-outs from healthcare workers irate over how honorarium payments from the government are being disbursed. The industrial action not only impacting the public healthcare system, but prompting Wells to recall 2 of the payouts. Cleopatra Murphy has more.
Minister of Health the Honourable Renwood Wells says his driver and personal assistant have returned the money they each received in honorarium payments intended for healthcare workers who responded during the early phase of the COVID-19 pandemic. In a taped recording on the issue Monday, Wells further denied social media reports that the 2 received $5,000.
I have asked both my driver and personal assistant to return the $1,158.40 that was disbursed to them from the Bahamas government. They have agreed and have returned the amount disbursed to them.
The Minister of Health also dismissed claims that he was the recipient of a $10,000 honorarium. Wells insists he was not involved in deciding who qualified for the payments, instead says a select committee from within the Ministry of Health made those selections.
This committee was to make the decisions based on the criteria approved by Cabinet for those who willingly stepped forward during the period the 19th of March to the 18th of June 2020, and for those who later joined the fight in the Ministry of Health.
According to the minister, government earmarked $1,040,600 in honorarium and death benefits to be paid. Giving a breakdown, $400,000 of that was earmarked for death benefits to the families of 4 healthcare workers who died in the line of duty, $640,600 to 143 frontline healthcare workers who stepped up at the start of the pandemic, while $3 million was approved in the budget to pay 1,700 healthcare workers.
Commencing 4th of August 2021, some 1,732 employees began to receive their payouts as follows: 308 doctors, 644 nurses, 111 emergency medical service staff, and 669 non-clinical staff. This group consisted of laboratory technicians, administrative, clerical, transport, security, custodial, and other support staff.
The entire issue has caused much angst, leading to hundreds of public healthcare workers staging a widespread sick-out that severely impacted the delivery of service. Staff at the Princess Margaret Hospital also walked off the job Monday. Wells now says there will be a review.
I shall be taking the list of those who were nominated to receive and yet to receive an honorarium to the Cabinet and Prime Minister for review to ensure that Cabinet's intent has been upheld and met as directed. Once again, the government of the Bahamas extends its deep appreciation to all frontline and non-frontline workers.
Cleopatra Murphy, ZNS Network News.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.